Hi, I'm Dr. Chambers and I want to welcome you to my website. I want to talk about thoracic pain or chest pain that often is disabling or unrelenting. This is the kind of pain that you get between your shoulder blades that will migrate around to the front of your chest, go up and down your spine, can even cause some arm numbness. Myofascial pain syndrome is the medical term. Myofascial pain means that there's fascia, which is like cellophane, that wraps every part of your body that separates the muscles from the bone. Pleurisy is a kind of fascia that gets inflamed, to give you an example. Trigger points, which is often referred to as fibromyalgia, is also an advanced stage of myofascial pain syndrome. So, this is a model of someone's spine. This here would be the mid-back or the broad line for you ladies. As you come up to the shoulders, you can see the muscles. Underneath all this area are muscles and fascia that can become irritated. If you take away the muscle, you can see you have the spinal column with the spinal nerve roots, or costal nerves, that travel from the side between the ribs, and these ribs will attach to the vertebrae and come around to your chest. People who injure this area can injure this muscle. The muscle gets injured in such a way that the blood supply to the muscle gets cut off. If you remember high school biology, you ate food, it was converted from food to sugar or glucose, and that's how you developed your energy. But the muscle needed to store energy in the form of glycogen. Glycogen is stored glucose. When the body calls upon it, it breaks it down and gives off a waste byproduct called lactic acid. That lactic acid, which makes you sore after you exercise or after you maybe cut the grass after a long winter. Normally, that lactic acid and toxicity gets reabsorbed through normal functioning blood supply that goes to the muscle or to the area that has been overworked. However, if the area has been injured, the blood supply gets cut off. The lactic acid and toxicities do not get reabsorbed back into the bloodstream. They form little pockets which we refer to as trigger points, which are sore spots that you can find along the muscle. If they get bad enough, these sore spots become toxic to the point that when you exercise, it gets worse. When you do the daily activities, such as if you comb your hair, brush your teeth, they get worse. And then you have this constant pain with soreness that can develop under your shoulder blade, between your shoulder blades, and between your spine. It can even affect the ribs that come around to the front, and you get this rib pain. Some people think they're having a heart attack and run off to the emergency room. EKG is normal, echocardiogram is normal, stress test is normal, but the pain remains. Here's the missing ingredient. The myofascial pain syndrome from a vertebra that's been injured, a muscle that's been damaged. But there's hope. There's effective treatment that can resolve these kind of conditions. But through chiropractic, physical therapy, myofascial pain release, and other type of modalities that we use here, we've been very successful dealing with these kind of issues. So, if you're one of those sufferers of chest pain, thoracic pain, mid-back pain, myofascial pain, and have not been able to get resolution, perhaps you need to come give me a chat, because this condition is treatable, correctable, and in many cases curable. Anyway, thanks for taking the time to visit my website, and look about, and I hope you have a good day.